When we're talking mid for a measurement, do not take measurements of something where you cannot see the margins. All right? So now I'm gonna press a little bit, breathe. I moved my shadow from here and I moved a little bit from that gas so I can see the edge of my kidney and the edge of my kidney, okay? So this is where we would do a length measurement. And you're gonna go from the superior pole to the inferior pole here, okay? That is your length. Now, when you're doing your height measurement, you can do it in trans because that is what is put on here. However, let me just say, take it where you can see it the best. Typically, transverse kidney is where you're gonna get the best height measurement. However, if you do not think you get clear margins, take it in this mid portion, okay? You can do it here to here. AP measurement, you want your kidney perpendicular on your screen. See how nice and straight I have it across the screen? That's what we're going for, and you're doing an AP measurement for height. The next thing you're gonna measure is the cortex. The cortex is the actual, what we call the renal parenchyma. It's the functional renal tissue. That's the cortex right here, this more like hyperechoic compared to this hyper. Everybody see that? The renal sinus is gonna be brighter. I'm gonna use my pointer, sorry love. So this is the renal sinus right here. This is where all your blood vessels and stuff are gonna course through, your collecting system, all of that. This is the functional tissue here of the kidney. So this is the cortex. So when we do a cortex measurement, you need to get it to where it looks even. You see from here to here, that pretty much looks the same, right? That and that, basically the same?
Yes.
So when you do a cortex measurement, it needs to look even across it, evenly represented. Just the same way when you do your gallbladder wall, nice and even all the way across, so I know that's the true width of it. So we're gonna put a cortex measurement here. And just to prove a point, I'm gonna put a cortex measurement here. You see how close those are? Okay, so that tells me this is really even, but this is where you would measure the cortex. You can measure it here, or you can measure it here. I would not measure it here. And why would I not measure it here?
Because it's the middle and will be folded.
Not necessarily.
You don't have a clear border?
It's not clear, okay? I can clearly see the margins where the cortex meets the sinus here. So this is that edge, and this is that edge. Do I see a clear margin here? Let me take all those off. Where I can measure? This would be falsely representing the cortex here, because you see how it's thicker here than it is over here?
Yes.
Okay. There's a lot of different variants in the kidneys that are gonna make that look thicker in that mid portion, so you're gonna get the more accurate measurement when you take it on either edge of the poles there, okay? Another thing is you've got all these pyramids in here too. So all of that anechoic part is blood vessels and collecting system. So if you get a pyramid, like this one right here, you're not gonna measure to the pyramid, okay? See that there? Your measurement would not go from here to here because you're not including that in the cortex measurement. You would go here to here, just the edge of that pyramid. Does everybody see that? Okay, that's cortex measurement. Deep breath. So once we've done those mid ones, I want to show you going all the way through. So this is medial because I've got blood vessels here. So that shows me that's the hilum where there's a split in the cortex here, you see, and all the vessels and everything are going in. Then that's going to be mid, and I'm going to go all the way out, completely out of that organ. See there? And then back. Breathe. That's lateral. Okay? No blood vessels, no pyramids. It's just renal tissue. Okay? But do y'all see how I swept all the way out and then came back in? So deep breath. If there was something hanging out on this edge, just barely clinging on to that renal tissue, I would see that. Because now I've gone completely out of that organ and back into it. And I'm going to go from lateral all the way to the medial, completely through that organ. So if there was any kind of masses hanging out here on that medial portion or here on the edge, I would see that. Does everybody understand? Breathe. Okay, so that was your lateral picture. I showed you mid. So now we're going to talk about putting color on it. Whenever you do color for the kidney, the point of the color is to show perfusion. Does everybody know what perfusion means? Okay. We're getting the blood all the way up and into every little nook and cranny of that organ, okay? So when you put your color on, you're gonna see it lighten up automatically. But you're gonna need to make adjustments to your scale and your gain to make sure you're showing adequate perfusion, especially in you guys that have young, healthy kidneys. There's no reason why you shouldn't be getting perfusion. Take a deep breath. So I don't want a lot of aliasing. I'm gonna put it on the mid. So I'm gonna go right about here. And I'm gonna make some adjustments. See if I can't bring in that color the way that I want. Oh, that's a lot of aliasing. Breathe. All right. So your color is going to be on your mid portion. You see how I have pretty much that mid image again? And then I've got the box is big enough to just cover my kidney. I don't want to see just this part, just that part, cutting off the edges, squinched up right next to it. Show me a box that my kidney can fit in. Put the kidney in a box. Make it fit, okay? So when we talk about perfusion and getting up into all of these parts of the kidney from the hilum, that's what we're showing here. Do y'all see how that goes all the way through and shows me color all through the sinus and all into the cortex? That's what your color picture needs to look like on mid, okay? Any questions so far? No? Everybody understanding it? Good so far? Okay. So, okay, so now we're gonna go trans. Do y'all notice what I'm doing too? Once I found where her kidney was, didn't move, did I? I didn't pick up my probe, not once, and I haven't moved. I've stayed right where I know her kidney is and just had her taking breaths and making my adjustments. So remember that when you're doing this. From that point forward, find your window and stick to it. My voice got a little high just then. Find your window and stick to it. Okay. So now, perfect example, I've got contact loss here. When I turn trans, that put a curved surface on a convex rib, and so I've got contact loss. So I know exactly where I need to be to see her kidney. I'm gonna put gel here and gel here and go right back to where I need to be. Deep breath. And I'm not moving around too terribly much, and look, I've got contact now. So finding her kidney, there she is. Okay. So superior kidney, losing contact again. There we go. Breathe. Okay. Make sure I had contact. So we're getting a lot of liver in your superior kidney picture for trans, okay? No hilum, no sinus, no blood vessels, just representing this very upper part of the cortex of the kidney and making sure I can see these margins. I will warn you, be careful when you're doing the superior kidney in relation to the liver. It can look like a liver mass, okay? Instead of the superior kidney. It can look like it's in the liver instead of outside of it. Do you see here where I made sure to see that margin? Where I could tell that it's sitting outside of it. Sometimes when you guys were taking your liver pictures, unintentionally you were capturing the kidney and it was looking like a mass within the liver. Okay, so just be aware of that when you're doing it. Deep breath. So I'm gonna find a different window for her on trans because of where her ribs are. And I'm actually gonna come a little bit more forward and high and come down through her liver. Look at that. And I can see, I still have a little bit of contact loss, so I'll put more gel. But do y'all see how much better that picture looks? Breathe.
Yeah.
Compared to the one before it. The one before it was kind of like, yeah, that's probably it, but still looks a little like unusual. That to me is a better, superior picture. I just would I would count myself points off for this contact loss, so make sure you're putting the gel. But I came more forward, like a subcostal transverse liver approach, and came down through the liver using it as my window to make sure that kidney stood out nice and clear. Do y'all see how much clearer that looked than before? So that's the approach I want to take on her, okay? Found a new window when I turned on a different plane, and that will be necessary. I'm not saying find your window and then don't ever move. If the pictures aren't good, you're obviously gonna move. Deep breath. Okay. So now I'm gonna come down through my liver. There's superior trans kidney. I'm gonna come a little bit further. And breathe. This is transverse mid kidney, okay? It's gonna look like a horseshoe or a C shape, and that is the goal. nice and even. Again, if I am cutting this in half and folding it, both of those sides need to match each other as best that you can prove. So this C shape here is going to be the mid portion. We can see blood vessels coming into the hilum right here, and I can see all of my margins for a measurement. So when you measure this one, again, you're making it as perpendicular on your screen as you can so you get the most accurate margins here. And your width is going to be, if you were to make an imaginary line connecting the edge of the cortex here to this edge here, can y'all see that? If I were to make that imaginary line, that middle point is right about here, and that's where I'm going to put it, and I'm going to take it all the way out to the edge. So if I had that right here, do you see that completely cuts my kidney in half, right?
Yeah.
Evenly each side. That's where you want your calipers to fall, when you've got it nice and perpendicular like that, okay? Now if we were doing our height measurement here like we have it on your protocol, here and here, because again, I'm perfectly perpendicular on the screen, that is an AP measurement, okay? Does everybody see this and understand it? Okay. So that will be your mid, and you'll do mid with and without the measurements, and then you'll do it with and without the color. All right, half a breath in. So here with her taking half a breath, this shadow coming off the edge of the liver is preventing me from seeing that edge. If I cannot get around that, this is where you'll take multiple pictures, okay? So I can take one showing me the edge, one showing me this other edge here, if I need to. Now breathe. Take a deep breath. Okay. See here how I avoided that shadow by changing my position? Much clearer margins. So if I put color on it, here's the tricky part. You want it perpendicular for your measurement, but what do we not get when you're 90 degrees to the sound beam when our color comes into play? You don't get flow. You don't get a signal, right? So we need a little bit of an angle. And now look at that. Breathe. That's what I want to see. Renal artery and renal vein. I got both. Here's renal artery, renal vein. And do y'all notice when I gave it that little bit of an angle, how much better that color showed up?
Mm-hmm.
That's what I want you guys to do. Just a little bit of an angle. Do I have a shadow here? Yes, but that's not the point of this picture. I already took the picture showing that one, right? So take me one good one showing this color when you're doing a color picture. This shows me perfusion out into the cortex here, okay? So that's what your color
What
picture.
about that box? It's so big.
My box is so big, Jody. Thank you. That was a test. Make your box smaller.
And look how she centered it immediately. She put it in the center.
Small breath. Gas, go away. Breathe. And I want to see that color going into the hilum, coming from the outside of the kidney, going into the kidney. And that is a much more acceptable box size. Okay. Any questions so far on that? No? All right, deep breath. Now we're going to do the inferior. So again, I'm going to kind of slide forward on her a little bit. And I'm not sliding down, I'm angling down. Okay? So I'm just going to keep angling all the way through, completely out. Oh, gas bubbles. I'm going to move. See how I'm moving away from the gas?
Yeah.
Not towards the gas? That does nothing for me. Move away from the gas. And all the way through, back in, breathe. That's inferior. Same as the superior, we're not seeing the sinus or the vessels. If you have a little bit of sinus in there, that's fine. But all the way through the organ and then back. Okay? Lather, rinse, repeat for the left kidney. Only thing I will tell you about the left kidney is you're probably going to be fighting more gas and more ribs. So you, in all likelihood, will be decubing your patients for the left kidney. It is generally the better pictures, but try it in supine anyway, see if it looks good. So I'm going to start a little higher and further back on her. Hey, wouldn't you know it, a kidney? I do know what I'm talking about sometimes. All right, deep breath. So on her, I am finding to get a good kidney picture on her, decent, look at how far back I am. It's really far back, right? Do I look comfortable?
No.
Not. This hurts. and the longer it takes me to scan your kidney, the more it's gonna hurt. Why don't you flip on your side for me? If you find yourself getting all the way and you're like, yeah, flip them, because look how much easier that is. Don't I look more comfortable now? Deep breath. Now be aware it's gonna move a little bit when you roll them. So now look at where my approach is on her. I'm like on her hip. That's my window, okay? Not all the way back here like it used to be, because now look. What even is that? That's nothing. Breathe. So be aware when you move them. I'm gonna scooch this just a smidge so I don't get gel on your pants. When you roll things just like the gallbladder, you guys got your first taste of that whenever you did gallbladder. When you rolled them, did it not completely change how that looked?
Yeah.
Okay. This is gonna create a different window because things are gonna lay it a little bit different when she's on her side. Push your belly out. So pushing the belly out, if the organ sits further back, is only going to push it further back. If it sits deeper and you want to come closer to the surface, pushing the belly out really does help. With the pancreas, the deeper the pancreas sits, you pushed your belly out, you brought it closer to the surface. It made it easier, right? Same thing. Her pushing her belly out helped a little, but I have all this gas. Relax. So I'm gonna try something different. Just watch what it looks like when she breathes. It's a pretty good window, right? And she's just breathing normal. So hold your breathing.
Teacher, what is right underneath that kidney pulsating?
Oh my gosh, it's beautiful. Breathe. What is that?
Aorta.
What?
I'm not, just kidding.
What is
Don't
it?
listen to me.
Say it again and say it like you mean it.
I think
Aorta.
you.
It's the aorta.
That's right. That's right.
That is the aorta. Don't second guess yourself. You were correct. I just want you to say it louder.
Okay.
That's her
actually
aorta.
The distal aorta, and sometimes that's the only way you can see it.
Does anybody know why I can see the aorta on her left kidney and not her right kidney?
Because it sits on that side.
Exactly, because it sits to the left. So if you're having trouble seeing the aorta, what are you going to do?
Sure.
You're gonna turn your patient over, see if you can see it this way. Sometimes this is the only window you have. So, beautiful.
Yeah.
Especially when you learn how to do renal Dopplers.
Mm.
That's going to be very important, and I'll show you why. Look at that. Small breath.
Wow. Is that
So
a
y'all
little
remember
Hernandez?
that
Yeah,
Alyssa
it is.
Hernandez has a
Practice
really good renal
renal
Doppler vessels. When y'all get to that in your senior year, breathe.
Good to know, I guess.
Yeah. This is her renal artery coming off the aorta and going into her kidney. Okay. So there's a lot of different windows for you to see other things whenever the, primary one doesn't work. Pancreas. You can see my pancreatic tail from this view of my spleen because they sit that close together. It's just how I'm built. She's made this way, it makes it easier to see. So find that magic window. All right. So that's really, with the left kidney, it's the exact same things I showed you on the right. It's no different. This is gonna be your more challenging kidney. The left is generally just always harder, okay? So find your good window and use all of the things. Not breathing, deep breathing, half breath, belly poked out, okay? And her position too. She doesn't have her rib cage all kinked up here with her hip bone. She's nice and straight and stretched out. If you need, push that leg to the back. Yep, just like that. Opens up this space a little bit more here, okay? So keep that in mind when you do that. Every single time you move your patient, it might change how things look. So you can put your leg back. I know that was a little uncomfortable. Wasn't necessary. All right, take a deep breath. So whenever you have a situation, most especially you'll hit with your left kidney, where you can't get the whole thing in one view, breathe. I got a little gas thing going on here, but I can see the edge of that kidney. If I can't see it, I want you to take that one where it's pretty, and I can see that superior pole, and then come back and find a window, deep breath, where you can see that inferior. I don't know if you're just inferior poles, probably just cast out. Oh, here we go. See there how I found a different window?
Yeah.
Breathe. So I can't see that superior pole anymore, but I can see the inferior one from this angle that I took. So if you're going to take multiple pictures of the same portion of the organ, show me new information. That's exactly what I just showed you. Superior pole and inferior pole, because I couldn't get it both at the same time, nice and clear. Okay? If you have a shadow from a rib in the way, represent that. That's just contact loss. See that gas here covering everything? If I find no way to get around that, no window, take it in pieces. That will be your multiple images. Small breath and hold it. Breathe. And then when you're ready, a deep breath. Okay. So for her to get a measurement, do the best I can here. Breathe. This is just an example. I'm going to show you. If this is all you can get on a patient for a length, I'm mid, even sinus, fairly even cortex, and I can see both of my poles for a measurement. It's not perpendicular. It's not as pretty as the right one, but if that is the best that you can get, make it look as good as you possibly can. Tick all the boxes with what you're given, okay? So I would do here to here for my length measurement, okay? If I had to do a cortex measurement, I'm gonna go here to here.
Are you inner to inner?
It doesn't apply when it's not a vessel or a tube of some sort. It is on the edge of the cortex. So it's a margin, not an inner to inner thing. Does that make sense?
Yeah.
Inner to inner is only when we're talking about like some sort of vessel that transports something, some sort of tubular structure or some sort of fluid filled structure that you're trying to get a volume measurement on of some sort or a diameter measurement on. We don't consider inner to inner when we do measurements like this. This is just on the margins. So being able to see these margins here, see how clear that is? From here to here, you can tell the difference in that echo texture, right? Darker, lighter, that tells me that's a border. Darker, lighter, I know that's the edge. So make sure you're able to see your margins. If that means you have to change your frequency, change your focus, change your gain, do all of those things so you can make that as clear as you possibly can, okay? Deep breath. So for the left, your spleen is your window. Same thing I did with the liver. I'm gonna start a little higher up and angle down through it. Breathe. That's superior trans left kidney. Okay? If I have to go way back here to get it, you're not gonna have any spleen in your picture. So you won't be able to use that as a window if their kidney sits way further back. Okay? Which is why when you roll them, now you've created a window for yourself. Deep breath. Oh, I have a pretty spleen. So pretty. And here's our mid. Breathe. So on this mid portion, I have a big rib shadow in the way of my image. Not completely obscuring the image, but it's there. But do you think I could take a measurement here?
Yes.
Yes, I can. If this is what I have, this is the view I have, this is what we take. I can see my AP measurements. I can see my width measurement. I can see the edge here. I can see that I'm nice and even, and I'm perpendicular for the most part. Okay, so yes, you can take it there. Now, if that shadow was right here, can I take that for a mid measurement?
No.
Please don't.
Please.
Please, for the love of God, don't take this as a measurement if you can help it. Why can't I take that for a measurement?
You
Can't
can't
see
see
the
the
edges.
I can't see my edges. I can't even really tell if that's mid. Because I don't see vessels, I don't see a hilum, and my edge is obscured for my width measurement. Okay? Deep breath. So coming down through mid. Sometimes you'll have to just squeak it between them rib shadows. Here. And I'm going all the way through and back. And I'm going to run away from this gas shadow again. And breathe. And that's my inferior. Y'all see how I did that?
Yeah.
All right. That is kidney. Back on your back, please. Now we're going to do bladder. All right. You guys haven't done
Extra credit, right? For
No.
No, bladder is
Oh, okay.
required in your imaging. Your extra credit is bladder volume. Oh, and getting your kidneys perpendicular is extra credit. That should be easy. It's all good. So I'm gonna also give you guys just like a little heads up. When we start doing gynecological scans and vascular scans, we told y'all at the interviews we get very personal because we have to. We're in the medical field. All of the body is our domain. Scoot your pants down on your hips, please. So you're gonna be kind of low, and that's what I tell my patients when I do pelvic scans or bladder scans. Just scooch your pants down off of your hips. I'm not saying pull them out, but and I've had plenty of patients that went straight to the knees, and I'm like, man, that was not necessary. Or I just throw a towel over the whole thing. I'm like, okay, it's fine. We'll just do that. Yeah, men and women, full on pants to the ankles, and I'm like, that's not what I said, but it's fine. Whatever. So, when you're doing the bladder, scooch them off the hips is all we're asking. What I'll tell them too is lower them in the back, because they'll tend to pull them here, and then it still sits high up here, and all you're doing now is fighting against their waistband, and you're not going to be able to get your good movements. We'll see. Should be good. So, I'm going to start right about here, and I'm angling down. That's for bladder. That big anechoic structure right there is for bladder. So all the way through. And when we're doing these images for the bladder, kind of like when we talked about the gallbladder and clearing echoes, because you can have debris in your bladder, you can have blood clots form in the bladder, you can have masses in the bladder, all kinds of stuff. So we don't want to falsify that, right? We don't want to say you have debris in your bladder if you don't. So clear your echoes. Not too dark here, not too dark here, but I don't have any echoes in my bladder, okay? So all the way up, it's not super full, but it's not super empty either, so you're good. So when you do trans bladder, I think we just have you do one in each plane at the largest part. Long and trans, that's all you gotta do. One long, one trans at the largest part. So as I'm skimming through and scanning all the way through the organ, is that the largest?
They did it for me.
No,
How about there?
more so.
What about that one? That one's probably the largest, right? And when I say largest, I meant widest,
Oh.
because we're in transverse, right? So that's going to be a width measurement when we do a volume if you want your extra credit. That's what we mean when we say the largest part of it. Show me where you think it shows the most volume. So that would be your trans. Now I'm going to turn long. Now when you go long, you're going to have to heel toe it forward like this in order to see the bladder, okay? And what I'm getting here is the towel. So a little of this scooping action. Did y'all see that? I just kind of went, boop, just like scooped. And that's an iliac. So we're gonna go, how about there? Still got some contact loss, that's how low her bladder is, but I'm just gonna scan just to show you guys. So going all the way through to the other side. It's so long. Okay, so your long is gonna be where it looks the widest. There, kinda. Bowel gas moving here. Yeah, not so much there. It's less so. Okay, so probably that might be the largest right about there. Okay. You would need to clear those echoes and of course keep contact, but that's what I mean when I say you need to go lower, right? So when I was doing trans, I'm like way down here on you, okay? I'm not looking at it, I'm looking here. So keep that in mind. We're not like ogling somebody's pelvis, but you're going to need to go lower than you think you will. Okay? So, that being said, jets. I don't know if I'll get jets on you because your bladder's not real full, but if you've been hydrating, maybe.
So is that what we want to tell
Ah, there we go. That's a jet.
Oh, okay.
Yeah?
them? Do we want to tell the patients when we call them to say, try to have somewhat of a full bladder?
Yes.
Okay.
Somewhat. I mean, you're not going to get counted off if their bladder is little bitty. Just
Okay.
represent it accurately.
Okay.
Okay? So you don't have to have a full bladder. It just will help to see jets when it's not completely empty. So just
Okay.
tell them don't go to the bathroom like 30 minutes prior to your appointment.
Okay.
And that should be fine. They don't have to like drink
Burst.
a jug of water or anything. Well, because we have pelvic patients as outpatients that come in. The second they check in, they're calling us going, how much longer till you see this patient? She's going to pee her pants. And I'm like, nobody told her to drink 2 gallons of water. 1 16-ounce bottle, don't pee. That's all we said. So just, you know,
Okay.
don't have to go to the extremes with it. So for the jet picture, is that right or left jet?
Right.
Right. Right?
Yes.
Right. That is the right jet. Patient's right. Do you see these little like kind of mounds here? Like a little mound. I'm going to show it better. Different one. Let's see. Okay. So y'all see like the little mounds right here?
Yes.
That is where the jets are coming into the bladder. So
Okay.
that approach is going to give you the best angle to see your jets. If I'm angled all the way down here, I'm probably not going to see them. If I'm angled all the way up like that, less likely so. I mean, yeah, okay, I saw that one. Now your bladder's filling back up. So if the color is coming from here down, oh, there's your other one. Y'all
So
see
do
it?
you want
Mhm.
both in at the same time? Or?
You might not get them at the same time, but I do want you to show me both jets if you can get them.
Okay.
Typically, you have to wait a couple of minutes before you get jets, but not on somebody who's this well hydrated, I guess. But
Way
that's
to
what
go,
you're gonna do.
Alyssa.
You're gonna sit here and you're gonna kind of wait for a jet to come in. There's that right one that just came in there. See? And there will be red because why?
It's going towards.
Going towards my probe. So that's gonna be what you'll do. You'll kind of just sit here and hover, wait for a jet. That's gonna be her left one. Okay? And you would label it trans bladder left jet, trans bladder right jet. And if you get them at the same time, that's one picture. Good for you. Any questions on anything so far? Oh, let me show you volume real quick if y'all want the extra credit. So when you're doing a volume measurement, we're measuring. Jody, did we agree it was in? Oh, where'd she
On the
go?
phone.
No, I can hear you.
Okay.
She can hear you.
Sorry, bladder measurement. Inner to inner, or including the wall? It was inner to inner, right?
It's entertaining.
That's what I thought.
The wall, we want to measure that if it's thickened.
Correct. All right. So whenever you took your picture of long and trans in the widest portion is where you'll take the picture for the measurement. So if I'm doing long, superior to inferior, correct? So long is this way. Where is it going to be the widest? Probably right about here. Then I'm going to go in my trans. Oh, I probably shouldn't do a dual screen, huh? Can't see the edges. Dang it. Okay, disregard that. We'll do it separate then. So that's the length picture. When you do your measurement, that's length. Okay?
Okay.
Superior to inferior, that is the plane that we're in. So when you do transverse and you do the measurement, again, you're getting it at its widest portion. Look, your bladder's already up. So about there is widest. So again, your volume measurement is gonna be inner here to inner here for your height, and inner wall to inner wall for the width, okay? And you will put that in your package under the bladder. All of them should have it. If they don't, we'll figure out bladder dimensions. So when you hit the long length, height, and width, it will give you a volume. That is what we're looking for the extra credit, okay? It will be a volume measurement. And it needs all three of those measurements in the package to be able to calculate the volume for you. Any questions?
Is that when you're in trans only?
For what?
One in
The-
length.
Yeah, for the
long
volume.
and trans.
Oh, long and trans, because we need a length, a height, and a width to calculate volume.
Okay.
So you'll do the length one, put it in the package, height and width in the package, and it'll calculate the volume for you. And you take height and width in trans. Okay? All right. Any questions? Everybody feel good about it? Perpendicular kidney is what I was showing you all along, making it nice and straight across your screen. You get a little extra credit for that. All good?
Good.
Yeah?
All
Thank you,
right,
ma'am.